Thank you everyone for joining today's wonderful session. The title of today's webinar is Best Practices for Keeping Child Care Settings Healthy and Safe During the Pandemic, Improving Ventilation. We're so glad you can join us. I am Dr. Lauren Zajac, and I will be moderating the presentation. I'm a pediatrician trained in environmental medicine and am faculty at the Icahn School of Medicine at Mount Sinai in New York City. I'm also the clinical director of the New York State Children's Environmental Health Centers and the Region 2 Pediatric Environmental Health Specialty Unit, or PACU. And as Region 2, we serve New Jersey, New York, Puerto Rico, and the U.S. Virgin Islands. Today's webinar is co-hosted by the Children's Environmental Health Network and the Pediatric Environmental Health Specialty Unit, and is funded in part by the Agency for Toxic Substances and Disease Registry. We're excited to see the large volume of registrants for this webinar. More than 3,400 people are registered. In this important session on ventilation, a really critical piece in reducing COVID transmission in childcare settings is applicable to both family-based and center-based childcare settings. And as an environmental pediatrician, I think ventilation is such a key but often overlooked part of creating a healthy indoor environment for children. So I'm so delighted to be part of this session today and hear from our expert. The first webinar of this series took place last week on March 11th and focused on safer disinfectant use in early childhood education settings. It was expertly presented by Dr. Vicki Leonard from the Western States PACU and Bobby Rose, who is the program director and a child care health consultant at the California Child Care Health Program at the UCSF School of Nursing. The organizations that agreed to partner on this webinar are the National Association for Regulatory Administration, the Association for Early Learning Leaders, and the National Association for Family Child Care. So before we begin, a few housekeeping items. The presentation today will be recorded, and the recording will be available on the Children's Environmental Health Network website and also the PACU network website. The slides from today's presentation will be available on those websites as well. A certificate of attendance will be emailed out to you by the Children's Environmental Health Network after today's presentation for those of you who are attending the live event. The presentation will be about 45 minutes long, and webinar attendees can ask questions in the last 15 minutes. You can type in your questions in the chat box to have your questions read by me, the moderator, during the Q&A session. Please keep in mind that this is an interactive webinar and a computer screen is needed to view the presentation. Please note there may be delays when advancing the slides due to varying internet connection speeds. So today's webinar on ventilation will be presented by Marian L. Heyman. She is the Indoor Environmental Quality Unit Coordinator and an epidemiologist, industrial hygienist at the Connecticut Department of Public Health and the Environmental and Occupational Health Assessment Program. Marian uses science to explain indoor exposures and enjoys helping people make practical, informed choices about how to lessen or eliminate those exposures. She created indoor environmental quality IEQ units in the private and public sector. She has led numerous field investigations pertaining to things like anthrax, Legionnaire's disease, metallic mercury poisoning, lead exposure in construction workers, formaldehyde, and many others involving various microbes, chemicals, and physical agents. Marian, as well as the presenters from last week's webinar, Dr. Vicki Leonard and Bobby Rose, will all be available today during the Q&A portion of the webinar. We look forward to hearing your questions, and thank you again for joining us. I will now turn it over to Marian Heyman. Thanks.
Hi, everybody, and thanks for being here. I'm going to turn my video off so you can see my screen, and hopefully you can see my screen. So we're here today to talk about ventilation basics, particularly for childcare settings, both home settings and building, if you're in a larger building. Many of the comments that I will make pertain to any home as well. And I will just say that these comments are my own comments. And you've already heard from Lauren that our webinar is sponsored by the Children's Environmental Health Network and the Pediatric Environmental Health Specialty Units. And we are very grateful to them for that and for the opportunity to talk to you today. So the objectives today are several. Hopefully you'll learn at least 3 steps that you can take to improve your ventilation in childcare facilities, no matter whether you're a home-based center or a facility-based center. And after learning all these things, I think you'll begin to appreciate how ventilation fits into an overall healthy building plan, especially with respect to COVID-19 disease and other indoor contaminants. And most importantly for me is to give you information about how to get real good science-based information so that you can learn fact from fiction. Before we go further, I want to just talk a little bit about indoor air in general. So there are many things in the air that we breathe. And I think at this point, many folks know that the air inside buildings is actually more contaminated than the air outside. We know that some things are within our control. So again, I like to use logic combined with common sense. We control what we can, and if we can't control certain things, then there are other measures that we can take, and we're going to talk about some of those measures. But particularly in terms of COVID-19, the most important thing to understand is we are the source. And whenever we talk about environmental contaminants, we always talk about source control. So since we know the virus is spread when it comes out of our nose and mouth, we do what you've heard 1,000 times, and that is stay home if you're sick. We don't want to bring contagion to indoor spaces. Wear masks when you're indoors. Stay away from people that are not in your household. Wash your hands with soap and water. Keep your indoor environment clean, and use ventilation to dilute airborne contaminants. And that's the focus of our talk today. So first, let's just talk about a few examples of contaminant sources other than COVID. For indoor contamination in general, they come from a variety of places. One place they can come from are building materials that we use actually to construct our buildings. Everything from sheetrock to particle board to even paint on walls. All of these things contain contaminants that can get into the air. So what do we do about it? If you are lucky enough to get in on the ground floor and you have the opportunity to speak up before things are built, you can actually write into the construction specifications that they have to use materials and meet conditions that you specify. So what do you want to specify? You want to make sure that they use low VOC building materials or no VOC building materials. If this word VOC is not part of your vocabulary, You'll want to add this to your vocabulary list. VOC stands for volatile organic compound. And these are simply chemicals that evaporate into the air. Now, not all of these things are bad. For example, if you bring flowers into the house, you'll have that lovely aroma. That's not bad, but those are VOCs. However, there are many VOCs present in all kinds of materials that are harmful. And it is worth noting that usually you can smell them, but sometimes you can't. And just because you can't smell them doesn't mean they're not there. So we do want to pay attention to that and employ source control by specifying, don't put those in the building when you're building it. Same thing with furnishings. We want to say the same thing, purchase low or no VOC materials, and that includes fabrics, wood, floor covering, furniture, couches, you name it. If you stick to that rule, no or low VOCs, you're going to be ahead of the game there. It'll be helpful. Another big source are personal items. And usually when I talk about personal items, I'm talking about personal care items. So we usually are thinking about things like shampoos, lotions, perfumes, shaving cologne. Anything that's scented is going to liberate VOCs. So we like to try to avoid all scented products. Other things that contain VOCs are materials that you use to clean, all of them. And if there's a scent, they liberate that as well. Just because there's no scent, again, you still can be liberating VOCs, but it's something to pay attention to. Clean does not have to have an aroma. But I think most pertinent to this group here are things that perhaps you buy or you use in your room, your classrooms with the children. And this is it's true of everything, but it's particularly true of arts and crafts supplies. So again, stay away from scented products. And when you're ordering products, make sure that you're ordering things that say low VOC or no VOC. Even things as seemingly innocuous as markers. Back in the day, you used to take a cover off a marker and you'd practically be bowled over because it was such a strong smell. Now you can buy a lot of markers and paints and clays that are fruit scented or they have some scent. You want to stay away from anything scented because we don't want to put that stuff up into the air. And then the last category that we think about in terms of contaminants are activities that we do in the indoor space. So some things like things that generate dust, because it's going to happen, we're going to generate dust. There's a remedy, and there's a very simple remedy. And it's simply taking you can take a little spray bottle and fill it with plain tap water and just mist the surface of, if you're wiping with a cloth, you can mist either the surface or you can you can dampen the cloth itself. And using a damp cloth keeps the dust down. The same thing with sweeping. We don't want to sweep that dust and put that up in the air. So keep the dust down by just gently misting it with plain water. Another really important way to reduce contaminants, believe it or not, we see a lot of contaminants when we cook. It's really interesting. A friend of mine has done a lot of research on this, and he changed the way that I cook. The lesson learned here is always, always, always turn on your range hood when you're cooking. Well, first, make sure you have a range hood that works, and then turn it on, because that's going to pull all the particles and chemicals liberated when we cook out of the indoor space. And lastly, another common thing that we can all do is we can use vacuum cleaners that have HEPA filters before the exhaust end. A long time ago, these used to be outrageously expensive and most people didn't have them. But that's really not the case anymore. It's very easy to get a modestly priced vacuum cleaner that contains a HEPA filter, and we want it at that exhaust end because we don't want all that dust we just sucked up blowing out the back. So these are all things that you can do, and they're worth doing. They're definitely worth doing because they make a difference. Okay, we've gotten that out of the way. Let's now talk about ventilation. So at the very simplest, ventilation simply means bringing air in and taking it out without any equipment. So that means we're opening doors and windows basically to let air in and let air out. That's called natural ventilation, and many buildings use natural ventilation as the sole way that air is delivered. That's what I have in my house. I don't have any equipment that brings air in. It's windows and doors. Over time, we've changed the way we've used many buildings, and some buildings have windows, but you can't open them. And the other thing that we've done is we've put rooms in the middle of the building. So you may have openable windows on the outer rim of the building, but what about all the people in the middle? How do they get air? Well, they get air by using equipment. And the equipment brings the air in and it takes it out. And implied in this equipment is the fact that some filtering is going on because that's the way all of these things are built. So when you have a building like that, we call this mechanical ventilation, and it's good to know that there are a lot of buildings that have one or the other or both. You can have a building with both. I do want to point to a video, a short video. It's only 6.5 minutes, produced by the University of California, Davis, which is really great. It's a cartoon-like video. They do a fabulous job explaining ventilation in a very basic introductory way. So if you want to learn more about that, I definitely recommend checking out that video. I will be including a handout for all of you after the presentation, and you will be able to click on many links so you can look at all this material yourself and have it to refer to. I also want to just make sure that we have some definitions here. I know there's a lot on this page. Some of this I just put here for your reference. We're not going to talk about it, but you can look back if you need to. But there's a few that I do want to mention because you're going to hear me say these words a lot. And this is alphabetical order. It's not in order of importance, but the first one is air changes per hour. When you hear me say air changes per hour, there'll be a number in front of it, some number. So if I say 4 air changes per hour, for example, that means that all of the air in that room will turn over 4 times in an hour. When I say turn over, I basically mean the air will either be replaced with fresh outdoor air, or it will be cleaned by sending it through a portable air cleaner. So air changes per hour. HEPA filter, you've heard me say that word HEPA. It's an acronym. It stands for high efficiency particulate air filter. You'll hear some people say HEPA filter, HEPA, HEPA, same thing. It's like tomatoes and tomatoes. I guess it just depends on where you come from. The other two that I really want to make sure we're on the same page as in terms of vocabulary are these right here. If I say return, I'm talking about a vent or a register where the air in that room leaves. So you can think of it as an exhaust. You're returning the air from whence it came. If I say supply, I'm talking about a vent or a register where the fresh air comes into the room. So we're supplying the room with fresh air, okay? So if you are in a building that's mechanically ventilated, you can look up at the ceiling and you can see lots of different shapes of things. And this is just a few examples. Usually they're going to be mounted in the ceiling. Occasionally you will see them mounted on a wall. And if you live in a house that has a hot air, you're supplied by forced hot air, you'll probably be seeing those registers in the floor. If you have central air conditioning, those registers can be in a lot of places. They're usually either ceiling mounted or wall mounted, but they may use, because they're going to use the same ducts for them. They may, I shouldn't say, it depends on what you have. So they may use the same ducts. So in other words, if you're in a house, you may see them on the floor. If it's forced hot air heat, that is where you'll see them. If you don't have forced hot air heat, you won't see anything. I don't have forced hot air heat, so I don't have any registers. So that's where the air comes in. Where the air goes out, the returns. Most of the time, you're going to see them on the ceiling, like this one here. Sometimes, if it's a big space, you may see a big panel in a wall. And that's what this is right here. This, in fact, is the building that I work in. It's in we have a big open office plan, and this is kind of a hallway. So this is basically taking all that room air out and bringing it out from whence it came. You may look up at a ceiling and see something like this. What we're looking at here is these horizontal lines are where the air comes into the room. This is the supply. This is called a slot diffuser. And what's supposed to happen with all supplies is it's supposed to come in and then move down to reach the people, so the people can get the benefit. But sometimes we see a configuration like this. What we're looking at here is we're seeing supply, and the return is right on top of it. So what do you think's happening? Do you think this air is coming down and reaching the people? The answer is no. What happens when we see this is the air comes down a little ways and then it gets sucked right back out and it doesn't reach the people. This phenomenon is called short circuiting, and this does nobody any good, but there may be a very simple way to fix this. This room has what's called a suspended ceiling. So each of these ceiling tiles are individual, and if you push them up, you will find yourself looking up at a big open space. That's what a suspended ceiling is. So your air supply is going to be connected by ducts. However, sometimes the return is not. Sometimes you're returning air into that big open space. In this scenario, that would be good because all we need to do is pop one of these ceiling tiles up, because you can take them out and move them and change them. And you're going to ask your facilities people, hey, is it possible to move this further away? And if it's not connected by a duct, they'll probably say, yeah, we can do that, no problem. They'll do it while you watch. It takes 2 seconds. They just pop this out, put a solid one here, and then move this someplace else. And if you do that, now you have improved the ventilation dramatically, because now it can effectively come down and reach the people. So that's a really good thing. The lesson here is ask. Ask your facilities people. This will make an enormous difference. Sorry, I got lost. Okay, right. So the next thing, there we go. The next thing that you're going to want to know is it working? And you don't need a lot of fancy equipment. You can do this yourself. Everybody that knows me hears me say all the time, the eyeball test, the nose test, and the brain test. The brain test is, does it make sense? Use your brain. You know, let's think about this. So we want to know, is this working? Well, we want to know, is this a supply or a return, and is it working? Well, there's a very easy way to find out. You are going to need some kind of reaching tool. I do not want to see anybody doing this by standing on a desk or chair. We don't want anybody to fall and get hurt. The other part of my job is safety. So I want 2 feet on the ground when you're doing this. I'm short, so I always need reaching tools. So you're going to get some kind of stick. It can be a yardstick. It could be a branch. It could be, whatever you want. Then you are going to take a piece of toilet paper or a tissue and tape it to the end of your stick. Once you do that, you're going to hold it up against the diffuser. And what you want to know is it sucking or blowing? Is the air, is the tissue sucking up against that diffuser, or is it fluttering like a flag? Well, you can see in this case, it's sucking up against that diffuser. So what does that tell me? It tells me this is a return. I'm so used to seeing people and having them speak back. So this is a little unique for me. But it's sucking, so this is a return. It's sucking the air out of the room. You're going to do the same thing to other shapes and find that if it flutters like a flag, it's a supply. It's bringing air into the room. I will say to you that sometimes you have to work this a little bit. Sometimes you try it and you see nothing. You have to find the sweet spot sometimes. You have to move it all the way around until you hit that sweet spot, and then you will see something. Especially with the supplies. Even if you move it all around, you're not seeing too much. With the supplies, sometimes you have to just move it out a little ways, out a little bit from the register itself, and that may be your sweet spot. And you should see fluttering, and then you'll know it's a supply. If you have given it your all and you see absolutely nothing, that means it's either turned off or not working at all. So my first thought is it might be a timer switch. What happens with timer switches? Well, everybody knows what happens when the power goes out, right? You've got to reset your clocks. And you have to reset all the switches that make the ventilation systems turn on and off. So that would be my first question. I would call my facilities people and ask them, hey, we had a power outage. Did you reset those clocks? Another thing that I frequently see, especially in elementary schools for some reason, is because many of these rooms are exhaust only systems. They will have some kind of switch, and usually they hide it someplace in a closet, and you might not even know it's there. But the teacher before you may have known and may have turned it off because they're saying it's too noisy. If that's true, turn it back on. If you turn it off, that means you've turned off your fresh air. And not only might you be affecting your room, you may also be affecting all the other rooms on the same line. So we don't want these turned off. But if it's noisy, that's a signal, again, to call our new best friends, our facilities people, to say, hey, I'm hearing rattling and it's really bothering me. Can you take a look? Well, sometimes, again, sometimes it's a simple fix. It's a simple matter of they take this diffuser cover off and they find, there are screws loose. So things are rattling around. All they have to do is tighten up those screws, and guess what? The rattling problem is solved. That's an easy fix. Another thing that you might complain about, you might tell them, man, I am hearing something squeaking, squeaking, squeaking. It's driving me nuts. When they take that diffuser cover off, they may find, we've got a fan belt that's loose. We can fix that easily. They do, they go away, and everybody's happy. So sometimes it is a very easy fix. Not always. Sometimes something really is wrong and they have to, it becomes a bigger deal. But it's worth asking. The next thing I always like people to do is walk around the outside of the building. We want to look to see where the fresh air is coming in. We especially want to see where it's coming in. It's good to know where it's coming out as well. Sometimes we won't be able to see that because it's on the roof, but sometimes we can see it. So we've got an example here of a first floor classroom. So this is what we see inside. We walk around outside and we see where air's coming in. And this is probably about thigh high. So it's low. You can see this. Let's take a look at this thing, this diffuser cover. This is bashed into hell. How much air do you think is actually getting through this? Probably not a lot. So what's the fix? Simple. Replace this. Just put a new one on. Now we'll have nice open slots and air will be able to come in. The other reason why it's good to look is sometimes, especially if they're ground level, these things can get plugged up with leaves, paper, debris, what have you, and that's going to block the air. So if you see that, you want to make sure that it's not blocked. Okay. So we're going to move along a little bit faster because I do want to spend some time teaching you how to shop for a portable air cleaner. I just want to say that there's a really good report. You will have a link to this. This will talk about air changes per hour. And I'll simply say that, in the best of all worlds, we would love it if all rooms could achieve 6 air changes per hour. So again, that means the air in that room gets replaced 6 times every hour. That's dream world. We know a lot of people can't get there. But don't worry, because if you can't get there, there are other things we can do. There's a combination of things that we can do, and we're going to try and talk about those. You're not going to be taking these measurements yourself. The numbers here are really here for your reference. You're going to hire somebody to do that if you need to. But here's something that you can do. And this works really well, and it especially works well if you're in a home. You can help dilute the air by putting a fan, a plain box fan, in the window, and you want to turn it around. So if we wanted to cool ourselves, we would want that fan blowing on us, right? But now we want to turn that fan around so it's blowing to the outside and it's sucking air out of the room. That's going to make the air leave much faster than just opening a window. But these box fans never fit tightly in your window. And if there's space, the air is going to choose to go through that space and not through your fan. We're going to trick it. We're going to make it go through this fan by making a frame around that fills up this space. I like to use cardboard because it's readily available. Everyone can get their hands on cardboard. You can use whatever you want. If you have wood, you can make it out of wood. This is not a permanent, you're not installing this permanently. So cardboard is fine. Cardboard and tape, you're going to make it so now you've blocked up all those spaces and it fits tightly, and you're forcing the air through that fan. And then the next thing you're going to do to make this work even better is, if there's another window in the room, you're going to crack that window open a little bit while the fan is on, because that's going to force what we call makeup air. It's going to force outdoor air to come in and complete this cycle so we can basically replace the air in the room. This works really well. It works really well. And you know, the visual, I think, if you can picture a smoke-filled room and you want to get that smoke out, do this. It will work. If you've got somebody cooked something and it's stinking up your kitchen and you want to get that smell out faster, do this. It will work. It will work to dilute the air. And you can do it in a home. You can also do it in a room, a building that has windows that open if you want to. So that's diluting the air. The other thing we can do is we can actually clean the air. But before we do that, we have to know what the contaminant is. Is it a particle? And we're all thinking about particles because the viruses, COVID-19 virus, that's a particle. Dust is a particle. Dander is a particle. Mold spores are particles. There's lots of particles. Is it an odor that we're trying to take out? That's a chemical. That'd be a different thing. Or is it both? So we need to know. So we pick the right thing. And when you're picking, you want to pick something that is scientifically proven to work and doesn't hurt you. So that leaves us with pretty much one thing in my book, and that's filters. Filters are simple. We know they work, and we know they're not going to hurt you. But whatever you pick has to fit your situation, because everybody's situation is different. So if we're really talking about filters that trap particles, but if you do need to filter out chemicals for odors, you're also going to want to get a unit that has another filter in it. They'll either call it a charcoal filter or a carbon filter, or they may say activated charcoal, activated carbon. It's all the same thing. That's going to take the chemicals out. It is important to know your system before you go and upgrade filters, because if you upgrade and put something new in, you need to make sure that your system can handle it. These upgraded filters create more stress on the system. So I recommend always, always, always call the people that service your equipment and tell them, I'm thinking about upgrading. Is it okay? Can my system handle it? Most of the time they'll say yes, but if they say no, don't do it. Or you'll be now spending thousands of dollars. So make sure you ask. And again, this is true not only for big buildings, but for homes as well. Homes that have, again, forced hot air and central air, you have filters in your system. So the three real critical things you need to know is you need to make sure that those filters are installed the right way. They're installed correctly. How do you know? There's an arrow on the filter. The arrow must point the way the manufacturer says. If it's in backwards, it's not going to do its job. Next, the filter must be tight, tight, tight in that frame. We don't want to see rattling. We don't want to see broken, bent, or missing frames. If we do, we're going to get that bypass and the air won't go through the filter. So that's really important. Must be tight. And then the last thing is fans. You don't get any filtering if the fans don't run. So it's important to know what kind of system you have. If some systems are designed for the fans to run all the time, and some aren't. So if you have one that doesn't run all the time, now we start thinking about, might there be other things we do when the fan's not running? And this is a conversation that you're going to have with your HVAC, your techs and your HVAC people, your building facilities people. Sorry. Okay. So you'll hear people talk about two different kinds of filters, HEPA filters and MERV filters. We described HEPA. MERV is a different kind of filter. The MERV filters have numbers on them. MERV 1, MERV 2, MERV 10, MERV 13. The number is just a way for you. It's a rating system. All you need to know is the higher the number, the more efficient. Both of these filter types will take particles out of the air. The difference is they're designed differently, they're tested differently, and they're certified differently. In general, they're not interchangeable in systems. We don't want to put HEPA filters in general in a system that's not made for it, because they put a lot of stress on the system. So they have to be specially designed to take it, and this is not needed for most buildings, so we generally don't recommend that. There are certain buildings that are designed to take them, hospitals, pharmaceutical clean rooms, things like that, but generally no. However, there's lots of equipment that is designed to take HEPA filters, like our vacuum cleaners and our portable air cleaners. So that's really a good segue for us to get into that. Once we start shopping for portable air cleaners, we want to pick one that uses a true HEPA filter. They do make ones that have these metal plates. They're called electrostatic precipitators. The selling point is, well, you don't have to buy filters. Well, that's true, you don't, but I'm not a big fan of those because some of them can liberate ozone, and ozone is a chemical that will damage your lungs. So we don't want ozone. We avoid that at all costs. So again, stick with what we know. HEPA filters, proven to work, won't hurt you. All these other doodads you can buy on these portable air cleaners, they're not necessary, and I would stay away from them. We just don't. They're not worth it, and they can hurt you. If you already have one that has some of these things, turn those off. Do not have those running when there are people in the room. The California Air Resources Board website is a good website to know about, because they actually test portable air cleaners, because they have a law that says you cannot sell a portable air cleaner that generates ozone. So go to this website if you're interested. They also have lots of great general information about portables. What do you need to know once we start shopping? A couple things. You are going to get your tape measure out, and we are going to measure the length of your room and the width of your room. I also like to measure the ceiling height, because a lot of the calculators that are out there assume that we have an 8-foot ceiling, and we might not have that in our room. You might have a cathedral ceiling in your house, or you might be in a room with, a taller ceiling. So it's not good or bad. You just need to know it, because if that's your case, you're going to have to size up. Another thing that is very useful to know is the noise rating for the portable that you're looking at, because it varies tremendously from unit to unit. So you can use this as a rule out tool when you're shopping, if this matters to you. It doesn't matter to everybody, but if it matters to you, you can use it. So next we're going to go to one of these calculators. We're going to use the AHAM calculator. That stands for American Home Appliance Manufacturers. So let's head on over. I didn't want to do this live because I didn't want to have technical problems, but you can go to this web link and you can see this calculator live. Okay, so what do we want to do? The first thing we want to do is we want to put in our room size in square feet. So that means length times width. So for example, my bedroom is 8 feet by 10 feet. 8 times 10 is 80. I would put 80 in this box. I'm assuming that we're talking about a room that's a whole lot bigger than my bedroom, so I just made up 300. I'm using a room that length times width equals 300. You can limit to brand if you want to. I didn't for the sake of this, but here are two things that you do want to look at. We want to use the Clean Air Delivery Rate, CADR, Clean Air Delivery Rate. That is going to tell us how fast it's going to take the contaminants out of the room. So for a bigger room, I like to use a minimum of 250. So you're going to put that in these boxes. You're going to go to this box right here and you can choose equal to, less than, or greater than. I want you to choose greater than. And you're going to do the same thing for this one. So we're looking at tobacco smoke and dust. The reason why we're looking at these things is because this will capture the particle sizes that we're talking about here. The COVID virus is in this range. Pollen, we don't care about because pollen is huge. It's physically big. If you can capture this, you're going to capture this. So it doesn't matter. So you've done this. Now you're going to hit search. When you do that, it will pop out a whole bunch of choices. And you can see I got 160 choices here. That's a lot of choices. Unfortunately, who wants to weed through 160? We don't, we don't want to be bothered with that. But they don't put the price on this page. If you click on this, you can see the price, and you can use that as a weed out tool. You'll get more information once you start clicking on these things, but it's still not going to tell you everything you want to know. So what I like to do is do my weed out using price or whatever you want to use, get a handful, and then I like to go to the company website. So this is made by Company A. I'm going to go to Company A's website. I'm going to look up this model, and I'm going to look at the spec sheet for that model. Now, this, again, this is for a specific company. They're not all set up this way, but it's good to know what you can learn. So you can learn what this one will cover. So this is a big one. This one will cover up to 700 square feet. It's telling us that, and it's telling us it cleans all of the air in the room every 30 minutes at the highest setting. So you might like to know that. And even though I put in 300 as my criteria, a room size of 300, so this is pretty darn big. If I had a cathedral ceiling, or I might want something bigger. We always want to size up anyway a little bit, because the test is, they test these things in a sealed room, and in real life we don't live in sealed rooms. We've got air coming under doors and all kinds of things, so you want to go a little bigger. But the next thing that is really useful to know is filter cost. These people are telling us the filter, when it's time to change it, is going to cost $69. You might say to yourself, wow, that's expensive. But look at the filter life. They're telling you for their device, that filter is going to last 12 months, and they assume you're going to run this thing 24/7. Most people are not going to run it. They don't need to run it 24/7. So that filter is going to last a really long time. So it looks expensive, but actually it's not. You're getting a pretty good deal here. Another thing that's really worth looking at is the warranty, because again, they're all over the map. This particular one has a lifetime warranty as long as you register the product and you have a filter subscription. So that's pretty darn good. And then the last important thing is that noise level. So they're telling us that this unit is 39 decibels at the quietest speed, the quietest fan speed, and 55 decibels at the fastest or the loudest. Well, what does that mean? I'm going to show you. 39 decibels at the quiet. That means it's barely above a whisper. 55 decibels at normal conversation level, that means pretty quiet. So this unit happens to be unusually quiet. We don't usually see that. I'm seeing Lauren, which means that I'm probably getting pretty close to my time here. And she's nodding yes. All right, so let's see what we need to just fast forward through. This was really, I did want to talk about placement. You want to make sure you put it near the center of the room if you can. We want air circulating around the whole thing. We don't want to stick it in a corner. It's not going to work as well. We like to see you bring it off the floor. You can put it on a desk or a table. If you can't do it, it's okay. You can put it on the floor. But if you can, that helps. And another thing to note is a lot of ads will tell you that all the alphabet soup of all the agencies approve and certify. They do not. So know that that is not true. And I have a feeling that I'm probably needing to wrap this up here. So let me just quickly, portables. I've given you information so that you can learn how to build them yourself. So you can go to those websites. I like this model a lot because there's data on it. It works very well. I have a feeling I probably can't say much more. Is that true? So I guess I'll simply say that you'll be able to look at these at your leisure. I'm happy to answer any questions. There will be a handout for you so you can refer for more information. And there's some extra credit things for you to look at on your own at the end that show you how combining mask wearing with ventilation can be very, very effective. And I thank you very much for the opportunity to talk to you today. And I'm just gonna, leave my contact info. Oh, there we go. And that's my fan where I made my mask. There you go.
Thank you so much, Marian. I really appreciate how clearly you presented complex information and gave us all very tangible and simple steps that we could take next, whether it's in our home, in our place of work, and child care center. So thank you. That was great. We have time for some questions. We got a lot of great questions in the chat. And for those of you who don't get your questions answered right now, the organizers will make sure we get you an answer after the webinar closes promptly at 2 o'clock Eastern. So I'm going to try to batch a few questions together because they are related. So with a ventilation system, someone asked, well, what can I do if I have no windows in my office? And assuming that that may be related to mechanical ventilation, how do we optimize that? Is there guidance on cleaning the ducts? Say if your center, if you don't have a lot of windows but have these ducts, how they should be cleaned. And then one more about ventilation system is just clarification on the suspended ceiling option and what specifically to ask the building to improve that ventilation. So sorry, it's a 3-in-1 question, but they were all such great questions. I wanted to get them out.
Okay, so can you review? So one is
Sure. So
about what can you do if there's no windows? What can you do if there's no windows? Simple
windows.
answer, buy a portable air cleaner or make a portable air cleaner. That's the answer. Should you clean your ducts? I'm going to generally say no, because when you do that, you liberate all kinds of stuff and it's mostly not necessary. EPA actually has some fabulous publications that talk specifically about that. And I didn't put that in my handout, but I can try and make a note to get those links so people can see. But no, we don't recommend duct cleaning. It's not necessary and can make a problem where a problem didn't exist before. A portable air cleaner is going to be your answer. And there was a third thing, but I forgot what it was.
Clarifying about the drop ceiling and what to ask the building team to optimize ventilation.
Okay, so that is only when we observe short circuiting. That's when you've got your supply and your return very close together. If that is your case and you do have a suspended ceiling, I don't really know if you need that many details. You can just ask them, can we move the return so it's farther away from the supply? I guess that's the answer. Does that help?
That does. That was
yes,
very clear.
they say no. Okay.
I have a few questions about air filters. One is, if you're running the air filter, should the windows be open or closed?
So when you say if you're running the air filter, I'm assuming you mean are you operating a portable air cleaner? Is that what I'm not,
Yes.
I guess I'm not sure.
Yep. Right.
So
I think the question was thinking if you have an air filter, a portable.
So if you have a portable air cleaner and you open the windows at the same time, you're not filtering the air from your room. So I would say no. I'd say while the air cleaner is running, you'd kind of be defeating the purpose. If your goal is to dilute the air by putting a fan in that window blowing to the outside, then yes, you want to crack a second window open a little bit. I'm not sure if
And
that
information, like someone mentioned in the comments, Head Start programs on the West Coast in California when there's wildfires.
Oh, yeah.
And you don't want to let in that indoor air during hazardous air quality days. Do you have any recommendations?
Yes, absolutely. So wildfires are a perfect time to get your portable air cleaner. That's what they're for. They are very important for wildfires. Yeah, and they're right. You're right. You don't want to open the windows because you don't want to let that nasty stuff in.
Thank you. And these questions, I am going to actually ask last week's presenters, Dr. Leonard and Bobby. We had some questions about, you know, when purchasing or furnishing a daycare, buying art supplies, if it has the ASTM compliance label or certification, can you assume there's no VOCs in those products and that they're okay to use in childcare settings?
Well, I can tell you the answer is no. You cannot assume that. So that means they're not toxic. So if a kid eats it, they put a crayon in their mouth, they're not going to get, they're not going to be harmed that way, but it does not necessarily mean there are low or no VOCs. But I don't know, Bobby or Vicky, have other things to add?
And work on this, and yeah, you're right. The problem is who does have a higher level of certification, and that I don't know, if anybody.
So the certification that I'm blanking on.
ASTM?
Either ASTM, but what's the certification that they use for the art products? I'm blanking on that right now. I can't remember what it is. It's different letters. I can't remember what they are.
Oh,
AP.
AP, approved product.
Right. So that pertains to the toxicity of the product, like if a kid eats it. Both of those. That has nothing to do with VOC. So just because it says that it is approved in those other ways does not necessarily mean it's low or no VOC, but it will say low or no VOCs on the product itself.
That could be a question
Thank
that
you.
that could be a question that we could research and provide feedback on when we post everything.
Thank
Sounds
you.
good.
Unfortunately, we're out of time. This was such a great session. Last week covering, what to use to disinfect safely, and today covering how to optimize ventilation to really keep indoor air healthy for kids during COVID and beyond. These are all strategies that hopefully you'll take with you, and once we're out of the pandemic, still paying attention and focusing on what products I'm using and is my ventilation system operating? And those are two major steps to create healthy indoor environments for kids. So thank you to all attendees. Again, this is recorded. You will have access to the recording on the CEHN and PASU websites, as well as the slides will be available. And we will be answering the questions that came in that we ran out of time to address now. So thank you all. This was a great session. I'm happy to be a part of it, and I wish everyone a great day.
Thanks, everyone.
Thank you.